My name is Tanner Moldenhauer. I'm in 1291, and I got Mycobacterium tuberculosis. Mycobacterium, the habitat grows in soil, water, and free-living form. Diseased tissue of animals. Peat bogs are specifically rich in mycobacteria. There's over 190 species recognized in this genus. There are three groups: Mycobacterium tuberculosis complex, non-tuberculosis mycobacteria, and Mycobacterium leprae. Human pathogens are Mycobacterium tuberculosis and leprae. And in March 24th, 1882, Robert Koch announced M. tuberculosis is the bacteria that causes tuberculosis. Here's a scientific classification. We're specifically looking at the last two, Mycobacterium and Mycobacterium tuberculosis. Mycobacterium tuberculosis is gram stain positive, although it does not fit gram stain positive category from an empirical standpoint because it doesn't retain the stain. However, it is still categorized as acid-fast gram stain positive. It's acid-fast positive. It has a cell wall that is wax-like. It's nearly impermeable, and the cell wall contains mycolic acid, large amounts of fatty acid, waxes, and complex lipids. And it is unlikely to create spores. Most scientists say that it does not definitively create spores, so it's negative spore. Here's a picture of the lipid-rich cell wall. You can see mycolic acids, and you can also see the peptidoglycan layer. Certain characteristics of Mycobacterium tuberculosis is obligate aerobe. It's rod-shaped. It has a 3 to 0.3 micron size. It's hydrophobic. It's slow growing. It likes a pH of 6.4 to 7.0. It's killed in 20 minutes at 60 degrees Celsius or instantly at 100 degrees Celsius. It's non-motile and it's non-spore forming. The causative agent of tuberculosis is Mycobacterium tuberculosis. You can see in this picture that someone is coughing the bacteria and another person is breathing it in. It is transmission by aerosol. It's airborne. So again, it typically transmits to someone by becoming droplets in the air, microdroplets in the air that contain the bacteria, and another person inhales it. Safety precautions are airborne. This includes gloves, gowns, proper hand hygiene, also includes a proper mask, being an N95 respirator, or a PAPR, which is just a powered version. It's a little more robust, and proper hand hygiene. Proper hand hygiene and correct use of PPE really diminishes the risk of transmission. Latent TB is where bacteria is living in your body without making you sick, that you breathe in the infection, your body has fought it off, but you don't feel sick and you have minimal symptoms, if none. Most of the time it's none. TB disease or active TB is there's an active infection, the symptoms are present, and the possibility for spreading the infection is present. Diagnosis is done by four main ways. The Mantoux skin test, they inject a little bit of PPD tuberculin into your forearm, as you can see in the picture. Then they check it 48 to 72 hours later. And really anything above 0 is abnormal, but 0 to 5 can be tolerable. The higher it goes, obviously the likelihood that something is going on is greater. They do blood and sputum cultures. When they test the blood, it looks for the immune response to TB. And then when they test the sputum, it just cultures the bacteria. The culture numbers vary greatly. They also do chest x-rays, NCT. Diagnostic imaging shows areas of your lungs where latent TB could be walled off or made into a granuloma. And active TB causes physiological changes. In this picture, you can see just to the right side of the heart, white opacities, which are not normal in lung findings in x-rays. Symptoms include cough for 3 weeks or blood, angina with cough or breathing, unexpected weight loss, appetite loss, fatigue, fever, chills, and night sweats. The pathophysiology is interesting as far as it goes. So you inhale the bacteria, which stimulates an immune response. It gets the activation of macrophages and produces cytokines. Then the formulation of multinucleated giant cells and the formulation of epithelioid cells. The macrophages changes shape from globular to flattened. And then what happens is they aggregate around the tuberculosis, the M. tuberculosis, and it creates a granuloma. And you can see in this picture, the picture 3, under the title 3, there's arrows pointing to like a granuloma of where that immune response is walled off that infection or that bacteria. Treatment, latent TB treatment, it's not infectious and it's treated prophylactically. So it's given an antibiotic, and you take about 6 to 9 months just to kill any bacteria that might be there. Active TB is treated with antibacterial medications for 6 to 12 months. It's treated with rifampin and pyrazinamide and the other 2 drugs. They're all typically given together, but it is imperative that people take the full course of the drugs for the full time, or else drug-resistant strains may become more prevalent. Drug-resistant TB is very hard to treat. The drugs are usually way more harsh. And on top of the regular drugs, they're given at higher dosages, but fluoroquinolones are given. These are really expensive. Like the initial dose, I think I was reading, was $100,000. And it's really hard on the body, and it only is cured about 50% of the time. Also, treatment, they have supplemental strategies, O2 therapy, mucus clearance, bronchial hygiene. They use vest/CPT treatment, which is percussions, to get the mucus moving and out of there. And then at times they use positive pressure ventilation. There is a vaccine. It's called the BCG, Bacille Calmette Guerin. It's not widely used in the US because there's a low risk of infection in the US. It's used in countries with high prevalence of TB. This is to prevent childhood TB meningitis and military disease. The potency is variable against adult pulmonary TB. It works some of the time, but not all the time. And the vaccine can actually skew TB test results. So there's special criteria for results when testing someone that has the vaccine. TB is curable, although the spread must be stopped to cure it 100%. To get rid of it, the best way to stop TB is by spreading it. So if you seek medical attention early when you have the signs and symptoms, I read you can infect 10 to 15 people within a year if you don't get it checked out. The leading infectious cause of death in the world, the WHO estimates that 1/4 of the world population is infected with Mycobacterium tuberculosis, and approximately 1.8 billion people were affected in 2018. 10 million fell ill, and 1.5 million died. So it's estimated that every 21 seconds someone dies of TB. The drug susceptible TB, the medicines do work, has a curing rate of about 95 to 97%, although there are different comorbidities that play a factor in that. Specifically, HIV decreases your chance of survival. Or the cure rate for MDR, was a multi-drug resistant strain, is 50%, 60% at best. My most interesting fact that I saw about the pathogen was in 1994 in Hungary, they found a tomb and there was 242 naturally mummified humans. In 60% of those remains, they found the bacterium, and it is expected that the tomb was 200 years old. So it's interesting to see that as long as you can trace back humanity, you can see that there are signs of something similar to, if not being tuberculosis in humans. Thank you for watching.